Did you know that the average person takes between 8,000 and 10,000 steps a day, which adds up to more than 185,000 kilometers in their lifetime? That's enough to circle the globe 4 times. With all of that in mind, it's true what Da Vinci says. The human foot is a masterpiece of engineering and a work of art. But you're only given 2 feet to last you your lifetime, so it's important to take care of them. We're talking once again with Dr. Bally at Bodyworks Physio to find out more about the benefits of orthotics. Dr. Bally, to start with, do orthotics really work and what are they?
Absolutely, Meg. Thanks for having me back. Orthotics are a prescribed medical device. So what that means is it means that they're custom. So a doctor would use a cast, an impression, or a laser scan to perfectly fit your orthotic. The whole idea with orthotics, it's basically to control the alignment and the function of the foot. So orthotics treat and prevent abnormal motion, the rolling of the foot by redistributing the pressure on the bottom of your feet. So you reduce pain and discomfort, calluses, and increase the effectiveness and decrease pain on the foot. So here's an example actually of a sport orthotic. This is actually something that I personally wear. I have chronic low back pain, plus I have sciatica. So I can't function without my orthotics. I still do my exercises and whatnot, but if I'm not wearing these in my running shoes, I'm gonna have an increased low back pain that day and standing around and treating patients.
So aside from low back pain, why else might a person need orthotics?
There's lots and lots of conditions. It's not just for foot pain. It's not just for flat feet. Orthotics can treat a myriad of symptoms and pain. So things like something near and dear to my heart is sciatica. Because I have increased pain down the right side of my leg, my right hip doesn't function for me well. I'm not balanced off. So my sport orthotic actually helps me quite a bit. Other conditions, besides athletics, most people think of orthotics for using it athletically wise, or people who run or stand a lot. Things like hammer toes. When you have a kink in your foot or the toes, the orthotic will help redistribute and redistribute the pressure across your foot, so it takes pressure off the toes. Bursitis, hip bursitis, knee bursitis. Bursitis is just a fancy word for inflammation of a fluid sac in your joint. So when there's increased pressure in that fluid sac, we want to decrease that pressure so the orthotic can help redistribute the forces in your body. Bunions, you've got that crazy toe. And with the orthotic, they're specially made. We can add special inserts and special bells and whistles on these to help realign your toe and have better function. So it may prevent a surgical bunion removal later on down the road. Back pain, which I've talked about before, a big, huge umbrella, arthritis in general. A lot of people, especially as our population is aging, there's a lot of stiffness in the feet, and we want to keep our elderly and our mature population as fit and walking as possible. So orthotics are great for decreasing pressure off of the feet. Construction workers, people who work in factories with steel toe. When your foot is in a steel toe boot and there's a steel shank, there's a lot of pressure coming up and a lot of pressure coming down. So you definitely need extra cushioning in there so that you don't get things like knee pain, low back pain, etc.
So what's the process of orthotics, like to get orthotics at Bodyworks? What's the process look like for that?
Excellent. Yeah. So what you would do is you would book an appointment with us, and we would have you come in, and what we would do is what's called a gait scan. So we're going to watch you walk and see how your feet are moving, how the knees, how the hip, like looking at everything from head to toe or toe to head. Then we have a laser scanner that will actually scan your foot, and it checks different pressure points, different angles on your feet. Then that is actually sent to our orthotic company, and they will actually make a custom orthotic based on your size, your weight, your history, and any medical conditions that are happening.
Okay, so based on all the information you've given us today, Dr. Bally, what's the next step for anyone looking to get orthotics for their family?
Yeah, definitely check us out, book an appointment. Check us out at www.bodyworksphysio.ca, or give us a call at 1-866-7-PHYSIO, the number 7 physio, to set up your assessment with our amazing Bodyworks team.
Awesome. Thanks so much for telling me all about orthotics today, Dr. Bally.
Thank you. Bye.